So today we'll discuss about pneumothorax case. So this pneumothorax is very important, life-threatening disease. So it is very important to know how to diagnose immediately and what are the first aid management, what are the hospitalization management. This is very important. In spite of all these things, is only one thing: how to diagnose spontaneous pneumothorax or tension pneumothorax or other any pneumothorax, and what are the first aid management. So in this patient, he is a 65-year male patient presented with sudden onset of breathlessness. First, we'll discuss about the definition of pneumothorax. What is meant by pneumothorax? Pneumothorax is nothing but the collection of air in between the pleural spaces. There are two types of pleural spaces. One is visceral pleura, one more is parietal pleura. The visceral pleura is one which will cover the viscera. There is organs that may include lungs, heart, whatever. So whatever the organs that is covered by the visceral pleura, and one more coverage is parietal pleura. This parietal pleura is covering overall of the. It will cover both of the in between. It will cover both the every what you call every organs it will cover. So these are called as the parietal and visceral pleura. So pneumothorax. Pneumothorax means collection of the air between the pleural spaces, in between the parietal and the visceral pleura. So how it will occur? This is very important because you know there are two lungs, right lung and left lung. So these are covered by the some pleura. So you just imagine if the pleural space collection there, if there is a more air in the pleural space, what will do is that lung is almost pushed towards the other side. You can see one lung is here, one more lung is here. So this lung is covered by something, that material. So in between that material, if the something air, if it is correct means this air will push this condition, like this air will push the lungs to the opposite side. So what you just imagine, if the patient is having right pneumothorax. So right sided pneumothorax means in the right side, in air is collected so that the lung will go towards the left side. So what will happen? These are having one complication. If the air is collected means that lung will go towards the other side and the cardiac shadow will go towards the opposite side. Means there is a cardiac shift and mediastinal shift. This will cause the patient, sometimes it will directly arrest the patient, like patient will end up with a death. So this is very important. So I will discuss what are the different types of pneumothorax now. So types of pneumothorax include spontaneous pneumothorax, tension pneumothorax, and other iatrogenic means there is no cause. That type of pneumothorax, these are broadly classification. In first one is spontaneous pneumothorax. Spontaneous pneumothorax, again these pneumothorax are classified into two types. Either it may be primary spontaneous pneumothorax or secondary spontaneous pneumothorax. Broadly we will discuss what is meant by spontaneous pneumothorax first. So spontaneous pneumothorax means there is a this air collection in between this pneumothorax occurs because of the no any trauma. You can imagine if the person any trauma, everything is there. That type if they during accident, bus accident, in a bike accident, if someone got hit here, so there will be a ribs blockage, and this rib will give the puncture to the lungs and parietal. In that time if it collects air means this is called as other. This is not like this is called as some other pneumothorax, like iatrogenic pneumothorax or other tension pneumothorax. In spontaneous pneumothorax, there will be no accident, there will be no trauma, there will be no hit. So without hit, in between lung causes, like primary spontaneous means if the patient is having some disease, like without any disease, like if the patient is not having COPD, if the patient is not having any TB and everything, if the patient is not having pre-existed cavities. So if it is without any reason, suddenly there is a lung trachea lung what you call that lung spaces in between the vesicular marking, they will break. After breaking, there will be a collection of the air. This is called a primary spontaneous. Secondary spontaneous means because of some extra condition like COPD patient and tuberculosis patient. In tuberculosis patient, if the patient is having cavity, so suddenly that cavity will break during the forceful cough. If it is break means the cavity contains air. If it is break means that air will collect in between the pleura and the visceral pleura. This is called as secondary spontaneous pneumothorax. So this is very important to know because how to take, like these are the spontaneous. One more thing is like iatrogenic. Iatrogenic means there are so many causes. If causes were not found, suddenly patient, it may be thin patient, suddenly got something hit or forceful cough. If the patient is having COPD condition, suddenly cough, sometimes he will got use cough reflex. That time suddenly maybe a bronchial tree may be break and it will form some air collection. So this is called iatrogenic. When tension pneumothorax, this tension pneumothorax you can see some reels, some photos, some films also you can see. Someone will come and they prick here, that will make patient will suddenly start breathing. So this is tension pneumothorax. So tension pneumothorax is very life. However, all the pneumothorax are life threatening only. Tension pneumothorax is very danger life threatening because there will be like we are breathing, we are taking inspiration and we are having some expiration. In tension pneumothorax, what will happen is person will take inspiration, he is unable to breathe out. So every inspiration, the air will collect and going like it will become like it will flow like balloon. So when the patient continuously taking air, there will be collection of the air in more. It is more. Within 5 minutes, patient may end up with a death. So what will do in that condition? In that condition, patient will, you can see some everything like someone prick here in between the clavicular and second intercostal space. So that will discuss later. So only thing is spontaneous pneumothorax, that is primary, secondary. One more is hydrogenic, one more is tension pneumothorax. Only one thing is how to diagnose tension pneumothorax. So tension pneumothorax to be diagnosed, it is like something called a backstride. What is meant by backstride? BECK, backstride. If the 3 symptoms are there, means 3 signs are there, means it is a tension pneumothorax. What are those 3 signs? First is patient is having suddenly breathlessness, unable to breathe out. He can take breath but unable to breathe out. This is in this condition. First sign, increased neck veins, like raised JVT, whatever. Second sign, hypotension. And third is patient is having like percussion, huge resonant, hyper resonant on the percussion. So these are the backstride that is suddenly diagnosed towards the spontaneous tension pneumothorax. Only thing, these are the classification and what are the clinical signs. So in this, how to diagnose based on clinical signs is only first inspection, palpation, percussion. In inspection, there may be a chest movements are not equally. If the patient is having some air in the right side, patient will have only left sided chest movement, right side already absent. So inspection part is over. Next, palpation. What is how to palpate? We can see if any trauma is there, means we can palpate the patient. So you can see for the any tension, like you can see palpable cryptus. You can see if the patient is having rib fracture, that fracture will go towards the lung, and that may cause some condition. So this patient may develop some swelling here, unilateral swelling. So that too swelling is it's like a spontaneous. You can surgical emphysema like palpable cryptus can feel. So this is palpation. Percussion is a very important. And how to percuss is you can percuss here. So if you percuss the same part, there will be hyper resonant lung sounds. In normally dull lung sounds are there. Hyper resonant lung sounds indicates patient is having pure air inside. So this is emergency condition. One more thing is on auscultation. This is fourth finding. On auscultation, air entry is completely absent in the same affected part. So these are the clinical signs and symptoms. So treatment in first aid. If the patient you are going in bus and bus stand, whatever, something happened. So what you have to do? If you are not having steth, you are not having anything. So how to diagnose it is an tension pneumothorax? We have to see the patient. Is there any jugular venous pressures were there? Patient chest movements is there or not? If it is movements is there, only one sided there or both sides is there. You have to see. And one more thing is percussion is a very gold standard diagnosis. You have to percuss. If the patient is having hyper resonant notes on the same side, definitely it is the air only. We have to put one needle. So now for first aid management, we can see there is something called underwater drainage or needle decompression. It is also called as needle decompression. So how to do needle decompression or underwater drainage is we have to take one pink needle or whatever, and we have to prick the in guidelines, old guidelines, so that in this is the clavicle bone. So in second in between the middle of the clavicle, second intercostal space, they have to push. So this is the first gold standard. Nowadays this is changed. Nowadays, because this is having some more injury to the lung tissues and more injury to the muscles, that's why it is changed. It is changed into the only point is fourth and fifth inter space only in between the this intra-axillary third or fourth intercostal area. So now in this patient we have put ICD. So only thing, if it is outside third to fourth or fifth intercostal space in between the axilla, so intra-axillary lines. So this is the pricking point. What you have to prick, and you have to put on water, and you have to, that pipe should be dipped in the water so that air bubbles will go. So this is only a primary. This is not a permanent treatment. You have only thing is we have to take immediately X-ray and see for the other conditions. If it is if it is more tension pneumothorax or whatever, you have to put ICD is the gold standard. How to put an ICD? ICD means chest tube. If in this patient you can see it, we have put a chest tube here so that the air will come and it will go here. As a ಸ್ವಲ್ಪ camera. When patient is asked to, you can see the bubbles here. Camera. Okay. So these are the bubbles. Means already pneumothorax is clearing now. So this is the only treatment. All the investigations goes like chest X-ray and HRCT is the main thing. First investigation is chest X-ray to rule out any pneumothorax and suddenly go according to the treatment. And the only thing is you have to see the causes. Either it may be tubercular changes, either it may be spontaneous or any tension. You have to treat accordingly. Thank you.